Today I wanted to share some information about predicting and preventing diabetes. So there are really two camps. So if we look at type 2 diabetes, I went to the American Diabetes Association website, and they have something called a risk test available where you honestly provide some information about your family history, your lifestyle, and they will indicate to you whether they think that you should go to your doctor and request an A1C test. And an A1C test is just a blood test, a blood draw that gives you a snapshot, an average of your blood sugar readings from the past 3 months. So it will indicate to your physician whether you're showing a trend that diabetes is in your future, which means you would be diagnosed with prediabetes. And this could mean that your body's not producing quite enough insulin. It may not be using the insulin that your body is producing effectively. There could be various factors. But the positive thing is with a prediabetes diagnosis, most physicians will tell you you can take action to hopefully ward off a full diabetes diagnosis. So perhaps it's introduction of some medication, perhaps it's exercise and diet, lifestyle choices. There could be things that you could do to take action immediately to prevent the onset of the type 2 diabetes. And in fact, perhaps you could do that for a lifetime and avoid that diagnosis. With type 1 diabetes, we look to JDRF, which is the national organization that focuses on type 1 diabetes, and they will send you to a website called trialnet.org. So currently, TrialNet is doing offering a blood test for individuals, children who have a family member with diabetes, because they tell you that relatives, if you have a blood relative that has type 1 diabetes, you're 15 times more likely to develop type 1 diabetes. So you can read a lot about that on JDRF's website or on TrialNet's website. But what that blood test does is it checks for 5 different autoantibodies that predict the onset of type 1 diabetes. And currently, there's nothing concrete that has been shown to prevent the onset, but that's what they're working for. That's why they're doing clinical trials and are doing studies, and they're trying to get people to participate in their Pathway to Prevention study, hoping that a drug or treatment can be developed to then prevent the onset of type 1 diabetes over the long term for people that are showing those autoantibodies. So there's information available about both type 2 and type 1 prevention and prediction of diabetes. Hope this is helpful to you. And again, check out the ADA and JDRF websites for more information. Have a good day. Thanks.